Hi, my name's William. I'm one of the F1 doctors who's also an academic researcher, currently in Nottingham University Hospitals. And this was one of the projects that we did back in Sheffield Children's Hospital. And we looked at eosinophilic esophagitis in an atopic pediatric population, looking at their phenotype and treatment responses. This project was done in conjunction with some of the gastro and allergy consultants. I would like to thank them for giving me that opportunity. And I would like to thank the Eosinophilic Diseases Network charity for giving me this opportunity to present as well. Right. In relation to this presentation, I don't have any conflicts of interest. So eosinophilic esophagitis, as I believe most of the people on this network would know, is a chronic allergic inflammatory disorder, presenting with symptoms such as food regurgitation, reflux-like symptoms, having some pain upon swallowing, and sometimes having a food bolus obstruction as well. In that case, needing some ENT surgical removal. And one of the things that has been established as well is that EOE is linked to atopic comorbidities and food allergies. And that's the thing that we'll be discussing today. The common management strategies for eosinophilic esophagitis include an initial trial of proton pump inhibitors, elimination diet, so in conjunction with gastro and allergy, finding foods that the patient could potentially be sensitized to, and then removing those foods and seeing whether or not that would help. And lastly, oral viscous budesonide as well. So the reason we did this study is because eosinophilic esophagitis is increasing in prevalence, and currently there's limited literature that characterizes patients with atopy and how that relates to their eosinophilic esophagitis, whether or not they get different symptoms, whether or not they respond better to certain treatments. Those are the things that we wanted to investigate. And the way we conducted this study was that it was a retrospective evaluation of all the children from Sheffield Children's Hospital with a diagnosis of EOE from 2020 to 2023. And we found that the age range in that case was between 2, so really young patients already getting EOE, and 16. The inclusion criteria for these patients include having the symptoms and upon endoscopy, having 15 eosinophils per high-powered field upon histopathology as well. And the exclusion criteria, the patients we decided to exclude are the patients with previous fundoplication and patients with airway atresia as well. Wanted to look at clearly the esophagus, which is why that was one of the exclusion criteria that we discussed between allergy and gastro consultants. And the parameters that we looked at for this study, when we collected the data, include looking at male to female ratio, age of diagnosis of eosinophilic esophagitis, symptoms at presentation, and overlap with reflux. So the context of these parameters are looking at all the data first, and then separating them into patients with atopy and patients without atopy, and seeing whether or not these parameters differ. And how we define overlap with reflux is EOE with a reflux index of more than 4 upon pH study and or a Demister score of more than 14.7. And the treatment response that we looked at in this case was looking at histological remission. So a decrease in eosinophils to below 15, to PPI, to oral viscous budesonide and elimination diets. And these were looked at each endoscopy as well. So now we look at some of the results from this study. So looking at atopic comorbidity, we can see that more than half of these patients with eosinophilic esophagitis had at least one atopic comorbidity. The most common one being allergic rhinitis or hay fever. And this chart on my right shows each patient and which patients have all three as well. And in terms of food allergies, more than half had at least one food allergy as well. The most common one being peanuts, which is also one of the more common food allergens as well, followed by tree nuts. And when we compare patients that had atopy versus the patients without atopy, this is what we can see, that there is significant difference between the male to female ratio. So in patients with atopy and eosinophilic esophagitis, there were more female patients, and the rest of the symptoms, or the rest of the parameters, there were no significant differences except for one of the symptoms at presentation, which was dysphagia. And we saw that patients with atopy presented with significantly more dysphagia compared to the patients without atopy. And in terms of treatment responses, the important one to see here, which we will highlight with one of our case studies as well for one of our patients, is that patients with allergies or atopy with eosinophilic esophagitis respond better to elimination diets, which makes sense. These foods are the ones that cause your body to have that mast cell propagation. So removing those foods in patients who are sensitized to certain foods would help in a more significant way, which we saw in our project as well. And this is one of the case studies, one of the interesting things to consider when we think about atopic patients going through elimination diets. One of these interesting cases was looking at one of our patients with atopy who started on an elimination diet. And after the elimination diet, he was sensitized to certain foods. So this patient was diagnosed with EOE at 6 years old. He was started on oral viscous budesonide, which he wasn't responsive to. That's why he was started on an empirical elimination diet, which included oats, milk, eggs, and soy. 2 years after that, within the 2 years of the elimination diet, he showed that upon endoscopy, there was a histological response. So his eosinophils did go to below 15. However, after that, he started having a reaction to egg. His symptoms included abdominal pain, vomiting, and diarrhea. And then when we did the allergic testing, the specific IgE to eggs, it showed that it was increased. It was 2.47. So currently the patient has been asked to continue avoiding eggs while waiting for an oral food challenge. And he had a bunch of atopic comorbidities like allergic rhinitis, asthma as well. So it's not common that we see patients like this. But according to the consultants in Sheffield, there has been 1 or 2 cases where after eliminating a certain food, in a patient that has atopy, the patient becomes sensitized to that food instead. So I believe the important discussion points from the findings is that there are significant differences in symptoms at presentation, dysphagia, that were found between atopic and non-atopic patients. And the EOE patients with atopy are more likely to respond to food elimination diets. However, there are certain cases, rare but important to continue looking at, where upon elimination diet, the patient gets sensitized to the foods that they were avoiding as well. Right, thank you for giving me the opportunity, and thank you for listening as well.